Hello, I'm Jess Wilcox and I'm a consumer representative. I do a lot of advocacy in the mental health space, suicide prevention and domestic, family and sexual violence space, and also disability inclusion.
It's wonderful to have you here, Jess, because so often when we're talking about creating solutions for patients and we talk about how important patients and consumers are at a conference like this, we can often not actually have that voice in the conversation. So I'm grateful to have you here for this discussion. I'd love to learn a little bit more about what's driving you for representing for some of these causes. I'd love to learn your story a little bit more.
No, thank you. I'm really grateful to be here. Bellberry have really supported this process and given 10 consumer scholarships, which I'm really grateful to be a part of. And being a part of AI Care last year and just seeing some of the transformation. I have a background in IT, which does become part of my story. And so I do have that. I want to touch on my story around mental health and the complexities of that, and also my experiences with domestic family violence and sexual violence, and how that can be incorporated into healthcare. Yeah.
Now, I'd love to learn a little bit more about, say, how some of these important issues that it can be tricky to address, and sometimes they become a little bit nebulous in terms of like how do we then really start to tackle some of these issues. And there can be initiatives, or there could be people or organizations responsible for kind of driving that change. But like, how do you see these important causes kind of coming front of mind to the digital health scene, like here at the event?
So I see this coming to the digital health scene from a consumer perspective, when we are really leading the way from our own experiences, whether they be in the mental health space, positive or negative, and how we can, in an advocacy space, from the domestic and family and sexual violence space. So from my story, I've had a lot of complexities in the mental health over the last 15 years, from a hospital space, public and private, also going to see doctors, clinicians, psychologists, seeing medication, like getting medication, all that, and experiencing domestic violence, and also the coercive control, especially tech-facilitated abuse, has really provided that layer of emotional control, and how it can be really just insidious, and that nature, it really, I don't think a lot of people in healthcare really realise it affects the individual.
Thank you for sharing that. You mentioned tech-facilitated abuse. I'd love to learn a little bit more about what that means.
Tech-facilitated abuse is anything that is abusive online, that can be via your phone or your device. A lot of examples are about sextortion, or also known as people have known as revenge porn, taking photos, posting them online without your consent. A lot of perpetrators have used their phone from a remote location and will turn on people's music through their Google Home. They will turn on air conditioning onto hot or cold from that remote location if they are aware and tech savvy. These are some of the things that I don't think a lot of people are aware enough. And when we have clinicians, not specifically a GP, but, like an OT and like a psychologist, or that implementing these kind of initiatives, especially through the NDIS space, not just within that space, but we're thinking, how can we, we're not thinking about the full picture of how can we stop people becoming victims of this perpetrated abuse.
Yeah. Well, no, I mean, you think about how these technologies allow us to have more information faster, or be able to do anything from anywhere. And we think about, for all those good reasons, like from a healthcare perspective, we might take the view that a lot of this needs to be done for good. And yes, we need to be secure and keep all of that safe. But often that conversation kind of comes from the point of keeping that data or information safe. But there's this whole world and this whole risk and this whole point that you just started to paint that can create pain for some people that would be on another level, because I imagine that creates a sense of helplessness, a sense of all new kinds of issues that I can't even start to fathom to think about. So it's something that I imagine is probably not even front of mind for people when they speak about some of these innovations that can come to market. So I feel like it's really important to bring front of mind.
When we think about including people with lived experience, we automatically go to those that have experienced, want to incorporate AI and digital health, but we also don't include those that experience domestic, family and sexual violence and how that can be affected, because I don't think there's that much research out there that is incorporating clinicians and the patient experience around how we can stop this from being affected from those two areas, which I think is really a prominent area that needs to be fixed. It's mental health and domestic and family and sexual violence are sitting in silos together in the health sector, but when we've got digital health as another layer and we're trying to teach them about digital health literacy as the patient, but we're also teaching clinicians and other people and innovators about that as well. From that perspective, I think it's a double-edged sword.
Yeah, absolutely. I start to think, well, what do we do about it? And I don't think it's an easy answer that we can kind of lay out here. But how do you start to think about how we should unpack this really tricky challenge? Is it like you touched on the need for research, or a lot of questions that are unanswered, or even things that we aren't even thinking about? What would you like to see people hear or HIC kind of walk away with, or start to think about to try and get us closer to at least starting to tackle some of these problems better?
I think we need to collaborate with a lot of consumer voices as a consumer representative and a lot of different advocacy groups and in a lot of different spaces. But I also think from also having that IT background, that it just can't happen from that clinician perspective. It can't happen from that digital health perspective. We all need to work together. We all need to work from NGOs. We all need to work from, which is, I think that's fine, but change management is one of the best things, and education, but also that it just doesn't, a lot of people know that it just doesn't affect, it can affect anyone, like from the CEO to, your next door neighbor. And when we're teaching somebody as a consumer or a patient and you're the clinician, I think we need to realise that that is the most significant point, that there is a lot to think about when you're implementing that new app, that new website. Has that usability feature been found, and what are we trying to figure out? Do you have the tick box of have they experienced this in their or are they at risk of this? Because that might be something else to include in their healthcare needs when, including digital health innovations. And I really think not even just mental health, when somebody's a chemo patient, they might be at risk of, going for their, going to court next week, for family court needs. You just don't know. And that could be a domestic abuse matter that is still something we need to really realise.